A very good afternoon to all. Oh, we are waiting for all the participants. Hope they will soon join. So let's wait 2-3 minutes. Number of participants are increasing.
Aman भी
Mr. Vivek, कुछ लोग YouTube पे भी कनेक्टेड हैं. ठीक है, ओके, थैंक यू.
Guys, please let me know when we are ready to start, yeah?
Okay, sir.
Thank you.
Miss Bharti, some of the students they are joining, or some of the participants.
Sir, students are joining.
Okay, okay. So let's wait for 1-2 minutes, then we will start.
Yes, sir. Sure.
Eight, 9, 10.
Students, mute yourself.
Yes, start हो गया.
Dhriti, mute yourself.
You can mute them. So participants, I think 80 they have reached. and we have the room for only 100. So I hope they will join in the meantime. So we can start. Bharti ma'am also start the recording of the webinar also.
Okay, sir.
A very good afternoon to one and all present in the webinar. We have a very distinguished guest, Mr. Sandeep Saini, with us. He is a very renowned person in community pharmacy since 2006. He is a registered pharmacist in United Kingdom since 2009. So he is having worked as a different manager levels. He is also owner and director of Forest Pharmacy. And he is also one of my best friend, I can say, my junior. And he is very hardworking person. He is excellent in his studies, and he's also having very friendly nature and very helpful. I hope all the participants they will be benefited by the talk of Mr. Sandeep, and he's a very wonderful person. What I have observed since we are connected last 20 years, more than 20 years. So I welcome Mr. Sandeep on this platform where we have more than 200 participants joined via Zoom through all over India. I hope seminar will fulfill its topic that how the international pharmacy practice and pharmacist license registration processes are there for Indian pharmacy graduates in UK and Canada. So welcome, Mr. Sandeep. Ms. Bharti, please start.
Yes, sir. A very warm and wonderful good afternoon to our respected Mr. Sandeep Saini ji, our most valuable guest, and Shri S.P. Bansal ji, Chairman, GEETA Group of Institutions, and Shri Ankush Bansal ji and Nishant Bansal ji, Vice Chairman of GEETA Group of Institutions, and Dr. Sunil Javla, Principal of GEETA Institute of Pharmacy, and all the participants and all my dear faculty members and my all dear students. It's my privilege to have you all here in this webinar. Success is not final failure, and failure is not fatal. It is the courage to continue the counts. The harder you work for something, the greater you will feel when you will achieve it. So, I, Bharti Verma, welcome you all to this webinar on the behalf of GEETA Institute of Pharmacy. Today we are here to have a look on the webinar entitled as Insight into International Pharmacy Practice and Pharmacist License Registration Process for Indian Pharmacy Graduates in UK and Canada. So it will be delivered by Mr. Sandeep Saini. Mr. Sandeep Saini has done his MSc from Emma Farms, UK. He's a director and owner of Forest Pharmacy, and he's having an experience of 14 years in UK community pharmacy. He has been working in community pharmacy since 2006, and he has been registered in UK since 2009 and have worked at different managerial levels. And at present, he is owner and director of Forest Pharmacy. So now I would like to call upon the Dr. Sunil Javla, Principal of GEETA Institute of Pharmacy. Sir, please.
I Mr. Sandeep, he is a students who are in the pharmacy profession and who want to make their career in the pharmacy profession. And I am very thankful to the management of GEETA Institute of Pharmacy and also GEETA Group of Institutions. Sri S.P. Bansilji, who is chairman of the group, and Sri Ankush Bansilji, vice chairman of the group. And I am thankful all the management persons and all the respected persons connected in the seminar. Participants, they are heartily welcome for this seminar. So I welcome again Mr. Sandeep Saini to deliver this seminar so that the most of the pharmacy persons they can get benefited.
Guys, thank you, Dr. Jawla. Is it over to me? Bharti, is it over to me? Can you guys see me okay?
Yes, sir.
Yeah.
Excellent, excellent. Guys, good afternoon, everyone. Thank you, Dr. Jawla, for putting so kind words about me and Bharti and the whole team. Right, so guys, my name is Sandeep. I'm a practicing community pharmacist. I'm an NHS contractor and owner of Forest Pharmacy in UK, as your colleagues just said as well. The aim for today's webinar is to give you guys a bit of insight into pharmacy practice in these countries, see what we do as a pharmacist, and also help you understand how you can use your Bachelor in Pharmacy, your B Form degree, how you can use it to convert into a UK registration, how you can register in UK and Canada using your B Form degree. Right, I'm going to try to be at a pace where I believe you guys will be able to understand. But if I'm talking in words that doesn't make sense, please bear with me, ask me as many times as you like, and let me know if you want me to go slower on anything, right? And I know this topic may bring a lot of questions to you, and I want to let you know that I will address as many as I can in the time we have. I will also leave my email address at the end of it, so you can contact me if needed. Yeah, am I clear, guys?
Yes, sir.
Yes, sir.
Excellent. Thank you, Bharti. Right. So let's move on. So who are we? We are all pharmacists or will be pharmacists. And pharmacists are basically registered healthcare professionals who are expert in medicines. Yeah. We spend at least 5 years in universities and doing practical training before we register ourselves as pharmacists. So it's a lot of time that we spend learning about medicines and illnesses and how we can treat illnesses and so on. So anyone, say for example in UK, anyone who calls themselves pharmacist gets themselves registered after 5 years of training into they write an exam that was organized by their council, and then they register with them before they can call themselves pharmacists. Same if you talk about Canada or America, you do their universities, again, 5 to 6 years, including the practical training, and you register with the College of Pharmacy in whichever province you are going to be practicing it. So it's a massive, massive big field. Today's aim, as I said, is to just get a bit of insight into how things work in these countries. Yeah? So what do we do as a pharmacist? Massive different environments that we work in. As you probably hear a lot in India that you guys work with. When you do your B Form or Masters or PhD, you go to academics, you go to industry, you work in different fields within the industry, and so on. However, in these countries, pharmacists, registered pharmacists basically work, majority of us work in community pharmacy and hospital pharmacies. There's slightly different in that respect that you'll find pharmacists here are working in communities and hospitals. What do hospital pharmacists do? Hospital pharmacist works in a wider healthcare team. So they're a really important, vital part of a bigger team. Yeah. And they focus on seriously ill patients, obviously going to from community to hospital. The patients are acutely ill. So you're focusing on really ill patients. There is a variety in hospital pharmacy that we as a pharmacist. Yeah? So you will have a team that includes pharmacist and pharmacy technician. You within the hospital, you may be working in the developing, testing, supplying, or maybe manufacturing within the hospital premises. There's a different department within the hospital that you will work in. You will also provide advice to your colleagues who are practitioners, you are GPs, consultants. You will help them evaluate the medicines, develop different protocols. Majority of the pharmacists working in hospitals are also specialized in their field. So you will find a mental health pharmacist working with mental health illnesses, then cancer specialist, heart specialist pharmacist, and different pharmacists focusing on certain parts of within the hospital departments. Moving on to community pharmacists. Community pharmacists work right into the heart of communities in these countries. Community pharmacists, which I'm very proud and passionate about, is all about helping patients. It's all about helping patients and public, assessing their conditions, see what's wrong with them, and making decisions about which medicines they should take. Yeah. So a daily routine of a community pharmacist involves checking the dispensed prescriptions, provide advice to the patients, do the medicines reviews, basically go through the meds that they're taking, the drugs they're taking, making sure they understand what they're taking. It's just making sure they're not having any side effects, any concerns, and also running different services, different clinics like smoking cessation, emergency hormonal contraception, or flu jabs, quite hot topic in this weather and with this pandemic going on, or doing COVID vaccines, which will hopefully be starting in the next couple of weeks' time. Basically, community pharmacies provide any service that's on National Health Services agenda. So there's a lot that both community pharmacists and hospital pharmacists do. These are two, you can say, lines where 90% or over pharmacists work in. However, then we have another group of pharmacists, like pharmacists working in academia, the pharmacists working in manufacturing, and so on. But there is only a small minority of pharmacists that goes in there. Again, a brilliant career progression in all of those.
Mr.
But
Sandeep.
Hi.
Mr. Sandeep, your voice is less audible. Can you use the earphone?
Can you hear me better now?
Yeah. Your voice is less audible.
I see. Can you hear me now?
Yeah. Now it is audible. Please continue.
Okay. Lovely. Thank you. Would you like me to start again completely? Will it be easier? Guys, just let me know. I don't mind. Just let me know if you can't hear me before. Would you like me to start again?
Yes, sir.
Yes, sir.
Please
Okay.
start. Please start.
Hi, guys. Sorry, there's a bit of noise, but just let me know if you like me to start again.
Yes, sir.
Yes, sir.
That's great. Sir. Thank you, guys. Appreciate it. Just let me know anytime if I'm going off, or if you can't hear, just let me know. I'm more than happy to start again, okay? Right, so I'm going to start off with the aim of the webinar, our webinar today. The aim is to give you a bit of insight into the pharmacy practice, see what we do in these countries, and also help you understand how you can use your B.Pharm degree to get registered as a pharmacist in UK and Canada. Is that fine? Are you guys happy with that?
Yes, sir.
Can someone say hi? Yes?
Yes,
Yes, sir.
Yeah, yeah,
Yes,
brilliant.
sir.
That's excellent. Thank you. That's great. Yeah, so I know this topic can bring some questions to your mind, and I just want to let you know that I will address as many as I can in the time we have. I will also leave my email at the end of it so that you guys can contact me if needed. Is that right?
yes,
Excellent.
Okay.
Right. So let's talk about pharmacists. Pharmacists are registered healthcare professionals who we spend at least 5 years in universities learning about meds and different illnesses. So we are, right into the core of understanding of disease and different conditions. Anyone who calls themselves a pharmacist in UK, Canada, US, or any other countries is basically registered with their regulator. In UK, all pharmacists are registered with General Pharmaceutical Council. Same if you go to Canada, they have College of Pharmacy that all pharmacists should be registered with, right? We pharmacists work in different environments, guys. We work variety. It's a very varied field. So you will find pharmacists working in communities, pharmacists working in hospitals, pharmacy working in manufacturing, prison pharmacies, universities, teaching, you name it, there is variety of options available for us as a pharmacist, right? However, in these countries, talking about Western world, pharmacists work mainly in communities and hospitals. So 90% 80% of the pharmacists who are registered pharmacists work in community pharmacies and hospital pharmacies. Yeah. Earlier on, I spoke about hospital pharmacy. I'm just going to quickly, briefly go through the hospital pharmacists. What hospital pharmacists do? Hospital pharmacists basically work in a wider team. They are really a vital part of a wider healthcare team where you'll have pharmacists, you have doctors, you have consultants, you have technicians. So they are important part of a wider team where the focus is firmly on the patient, just on the patient who is acutely very ill most of the times. Yeah, there is a lot of variety within the hospital pharmacy in terms of what you can do. You will always be working within a team of pharmacy staff, which normally have pharmacists, consultants, technicians, and so on. You may get involved in different departments that involves manufacturing, developing, testing, supplying, monitoring the effectiveness of all the meds used within the hospital. Yeah, you also provide advice to other healthcare professionals, not just the patients, and you may be evaluating the medicines and blood protocols. Most of the pharmacists working in hospitals either are or work towards specializations. So you will find in hospital pharmacists specialized in mental health, so they go mental health pharmacists, or cancer specialists, oncology, cardiology specialists, or different fields within that they work in hospital. It's an amazing career for people who wants to serve people within hospital premises. Excellent learning, great career development, fantastic place to be in hospital pharmacies. I have only worked briefly actually in hospital when I qualified. I think it was 2011 when I worked in Teddington Hospital in London. Loved it. All my time there, learned a lot at that time, but I was always very passionate about working within communities. So,
Mr. Sandeep, again some issue. Please, can you use the headphones?
all right, okay. Is it better now?
Yeah,
Dr.
Mr.
Javla, is it better now?
Yeah, now it is better. Either,
Okay.
oh, yeah, now it is better.
Excellent. Right, so this was a brief about what hospital pharmacists do. I'm going to move to community pharmacists. As I said, I'm a community pharmacist as well, and a very proud community pharmacist. Community pharmacist is all about helping patients and public, assessing their conditions and making decisions about what medicines they need. If you look into a community pharmacist's daily routine, you will find them checking dispense prescriptions, providing advice to patients, do medicine use reviews, which is basically going through their drugs, explaining them what they're taking, why they're taking, making sure they understand what they're taking, explaining them and highlighting any side effects or any concerns that you think there are. Also, we provide a lot of variety of services, whatever is on national health agenda, like flu jabs at the moment, smoking cessation, contraception clinics, and as a new one coming for COVID vaccines, hopefully soon in next couple of weeks. So that's what community pharmacists do. Am I clear so far, Dr. Javla? Can you guys hear me?
Yes, sir.
Yeah. And am I making sense to you guys, or am I going too fast? Just let me know, guys, because this webinar is for you guys. If you can't understand or making sense of what I'm saying, then it's just waste of your time. I'm just a bit concerned that you guys have come on a weekend, and I just want to make sure you guys can listen to me. Is that clear?
Yes,
Yes, sir.
Happy with the pace I'm talking?
yes, sir.
Mr. Sandeep, you can use also the Hindi language students so that they can easy to understand the webinar. You can use both the languages.
Yes,
And
sir.
Definitely, guys. For me, I'm more than happy to talk in any language you want, but I will mainly continue in English. But just stop me anywhere or ask me anywhere you want me to talk in Hindi as well. Is that right? Yeah.
So it's okay, sir. Just continue.
Excellent, excellent. Right, guys. So far we've just looked into who pharmacists are, and we've looked into where they mainly work, communities and hospital. We discussed where other parts, where they work as well. And now I'm going to move to a part where we're going to talk about how you can use your bachelor in pharmacy, B Form degree, and how you can convert into a UK degree and register as a pharmacist in UK or Canada. I've intentionally chosen these two countries, but the process is very similar in any other country. Um, One country which is very top of our destination to study and practice abroad is United States, and I have intentionally not kept it there because registration for pharmacists after who have qualified after I think 2004 or 6, I don't know the exact year, has been restricted. So we will may not be able to go through this process in each state, but it does apply to any other country you want to go and practice. But we're going to talk mainly about UK and Canada, right? We're going to move to UK registration first. I can see that Bharti has kindly put the slide up there for UK. Is that right? Can everybody see the slide?
Yes, sir.
Yes, sir.
Yes, sir.
Excellent.
Yes,
Brilliant. Thank you, guys. Thank you. So in UK, the registering body is called General Pharmaceutical Council, or GPHC. As you can see on the slide, I have put a website up there as well. So once you got a bit of clarity, or if you want to look further into it, you can go into that website and look for things as well. Yeah. First step when you start in registering process is called document evaluation. Yeah, what this topic means is basically you're going to be submitting some essential documents to the society. This GPHC council, we call it society. So you basically submit some documents to society. The documents are mainly your official transcript. So official transcript is basically all your mark sheets and few things that you ask your university, whichever, say, if you're qualifying from GJU or whichever university, Kurukshetra University or any university that you qualifying from, they sent your official transcript to the society. Then they will ask you for your good standing certificate from the council. So I believe that would be the case that all B pharmacy students get registered with the Pharmacy Council in India. So they'll ask for a good standing certificate that will be sent directly from the council to the society. Again, your official transcript will be sent directly from your university to the council as a part of this document evaluation. Yeah, they also need your English language proficiency in this document evaluation. They do it through an exam called IELTS. IELTS is a very basic English language exam. I'm sure you guys have heard about it at some point, but if you haven't, it basically have 4 different parts which test very basic English language skills. It has reading, writing, listening, and speaking. So all 4 parts. It gives you bands from 9. And as a minimum marks, you need 7 band out of 9 in all these 4 parts of this exam. It's very basic, and I highly recommend you guys to do that exam whenever you're planning, or whichever country you're planning to go to, if you are. Okay, really important. So this part, document evaluation, there'll be 3 main parts: official transcript that goes direct to the society. Then you will have your IELTS score when you have achieved 7 band in all different parts, that goes to the society, and recommendation letters from, I think there is one academic you need, and other one is work related. It could be work related or it could be both academic. That's not main thing. So all these documents goes to the society. Once the society receive all these documents, it goes to their meetings. They do meetings 3 to 4 times a year. Once it goes to a meeting, they evaluate your documents. That's why I put it as document evaluation. They evaluate your documents to see whether your degrees so far, whether your Bachelor of Pharmacy or your good standing certificate, and all the recommendations are good enough for you to study in UK, right? And this is the part you can very well start preparing while you're in India. So you can write IELTS. There's plenty of options available where you can do IELTS exam. So far, am I clear, guys, on this? Can you guys hear me?
Yes,
You
sir.
guys happy with that part?
Yes, sir.
Yes, sir.
Thank you very much. Right, brilliant, excellent. So once you've done the document evaluation, the society will let you know that you are eligible to study the next program. Yeah. So while you're applying for document evaluation, within that document, they will ask you what universities you want to go in. Yeah. In UK, this course that you need is a mandatory 1 year program that you have to do. This is mandatory, you can't skip it, but it's only provided by a limited universities in UK. I think there are around 7 or 8 different universities that provide this course. So when you apply for document evaluation, they will ask you which universities would you like to go to, and if after the document evaluation, if they find you that you are eligible to study in UK, they will send your qualifications directly to the university, so you don't have to. Okay. Next part is doing an overseas pharmacist assessment program. This is called OSPAP. Once you've done your document evaluation, that's the second part. Yeah, this is a 1 year postgraduate program. You can do a project in some universities and make it a full master's, but its mandatory part is 1 year program. That's eligible. I think it's available in like 7 to 8 different universities. It's a very structured program. Is designed to make sure you receive the right education and training to prepare you practice as a pharmacist in the UK, and to complete the pre-registration training, which is the next step. Yeah. So we've done 2 steps so far: document evaluation, and then you've done the overseas pharmacist assessment program for 1 year. The second part is once you've done the program, you need to do a pre-registration training, which is a practical training. And luckily in UK, it's a paid training. You do get paid. It's not a fully funded like a pharmacist, but as a pre-registration training, it's salaried. You do get a stipend from the NHS. And it's a full 1 year training as well. It's a practical training that you do with your tutor, who is a trained pharmacist. The pre-registration training you can do fully in community, or you can do fully in hospital, or you can do partly. A lot of students choose to do partly 6 months in community and 6 months in hospital, so that you got the taste of both worlds. Yeah? There are a few options available, although very limited for nowadays, for pharmacists to go and do the trainings in industry as well. But again, as I said, that's limited. This 52 weeks training is very exhaustive, because you'll be working full time, but you'll be studying as well, because at the end of this training, you will write the final exam. Okay, that final exam, once you completed the 52 weeks training, your tutor, your pharmacist that you're doing the training under, will sign you off. And if they sign you off as satisfactory, that goes to the society, and then they will let you write the pharmacist registration assessment exam. This is the final exam before you can be a pharmacist or practice as a pharmacist. This pharmacist exam is very structured. It tests your clinical knowledge. It tests your legal judgment. It also tests your calculations. So it has 2 parts. Both parts needs to be passed. First one is clinical, as I said, and the second one is calculation. In the calculation, 70% is minimum. So in the maths part, which is basically calculation, you must get at least 70% to pass the exam. If you get 90% in the other one, but get 69 or less than 70 marks, you fail the full exam. It's quite an exhaustive exam. It's tough, but once you've gone through the OSPAP and you've done a year's training, that's 2 years of your training towards this. And I'm sure you'll be able to pass the assessment. Unfortunately, you only get 3 chances to pass the assessment. If you fail the exam 3 chance, you will not be able to register as a pharmacist in here. and you get maximum 4 years to complete. So if you go over 4 years, then you have to start the whole process again or may not be able to. And the 4 years starts from the time you apply for document evaluation. So going on to the first step. Is that right, guys? Are you guys happy with it?
Yes,
Yes,
sir.
sir.
Yes, sir.
Yes, sir.
Yes.
Yeah. By all means, do write your questions and I'll be happy to answer when we finish the next part. Yeah.
Okay, sir. Okay, sir.
Thank you. Well done. Right, guys, let's move to the next slides that will probably talk about Canada. Excellent. So, like, guys, you just UK registration. The registration will be very similar, which I'll break it down into different steps and talk you through. But the way would be slightly different. The examinations will be slightly different, right? So in Canada, the first part, as you can see on the slide, it says enroll with Pharmacist Gateway Canada. So I have put on a website as well. This part is the document evaluation. Again, very similar what we discussed. In document evaluation, they will ask you your official transcript, recommendations, and good standing certificate that will be supplied directly from universities to Gateway Canada. They will evaluate your document, similar pattern as we discussed, and then they will let you know that you're eligible to study or write pharmacist exam or not. Yeah, are you happy with it? Then
Yes, sir.
once they've done the document, excellent, thank you. Once you've done the document evaluation, you can book your evaluating exam. Pharmacist evaluating exam, as it says on probably on the slide if you're looking at it, that exam is the first exam that you will write in Canada when you start the process of registering. That exam is not very difficult. It tests very basic knowledge of pharmacy subjects we study in India. It may be very comparable to any test that you do to get admission to like an M.Pharm course. Like if I, if it's the same, remind me, but we used to do an exam called GATE. That's if you're preparing for GATE, the subjects, the structure is very similar. Anyone who has worked hard and prepared for that exam will be easily able to pass that exam. So it's the first exam. After the document evaluation, the first exam is called evaluating exam, right? It's the first step towards your registration. Once you've done the evaluating exam, you have passed it, then you apply to PEBC, which again I have put on the slide for the qualifying exam. Qualifying exam is the main exam. It's your final step to qualify for certification with PEBC. Yeah, and this has two parts. This final qualification examination exam has two parts: MCQ and OSCE, right? MCQ is multiple questions, as you can see, and OSCE is a practical aspect. OSCE is basically where you will be going and seeing the patient, and there'll be a video recording. They'll be seeing how you see a patient, how you're taking the patient through the journey and understanding what they need and helping out with the right medication. Yeah, best part is OSCE, and the first part is called MCQ. Again, this is the final, so a little bit more exhaustive. Yeah, these are very well structured, both OSCE and MCQ. You can give these exams together. They are usually done twice a year. You can them together, or some people do one exam at a time and the next one at a time, doesn't matter. It depends on how you're prepared to do it. Very well structured, as I said, and it tests your knowledge and skills to be a pharmacist in Canada. There is no as such set syllabus for questions, but it's about your application of your learning while you're doing your training. Yeah, there is a lot of reference books and topics available again on PEBCCA website that I put up there. These exams are competitive, very competitive, and scoring is done on a percentile basis. Yeah, you must prepare, I would say, quite well in advance. Give at least 4 to 6 months to prepare for part 1 and 3 to 4 months for part 2 after passing the part 1. Yeah, so both exam quite exhausted. Give yourself, in my opinion, 6 months for evaluating, but at least 1 year to divide your part 1 and part 2 MCQ and OSCE for the qualifying exam. It's the is the toughest hurdle, I would say. Once you pass the evaluating exam and your both parts of qualifying exam, the next step is to pass the law exam, which you probably see on the slide as jurisprudence exam. This is just a law and ethics exam. Again, very easy. Each province in Canada have their own college of pharmacy, and they have own slightly different jurisprudence exam, but they are fairly easy. Yeah. Then you submit. Once you've done that, you submit your English language proficiency. Again, you can do it through IELTS, or you have similar exams, but this part again you can do while you're in India. IELTS scores are only valid for both UK and Canada for last 2 years. So whenever you do IELTS score, it has to be within 2 years, right? And also there is a slight difference in UK. If you want to do the IELTS, you have to have minimum 7 band in all different parts. However, in Canada, you just need the total 7 band score, which is even easier. Both parts are fairly easy. It's not an exam to be overly worried about, fairly basic language test. So once you've done these 4 steps, the last one is your practical training. Again, practical training depends on which province of Canada you are going to be practicing in. It varies from 6 months to 1 year. It used to be even less, but it's going to be 6 months to 1 year. Again, you do with a pharmacist. Again, he'll be your tutor who will be signing you up before you can practice as a pharmacist. The whole process, I would say, both in UK and in Canada, takes around 2 to 3 years. I would say an average around 2.5 to 3 years should be maximum if you're working hard towards it. Are you happy, guys? Are you happy with this so far?
Yes, sir.
Yes, sir.
Yes, sir.
Excellent, excellent, excellent. Right, so now, guys, what we have done so far is you've seen how you can register as a pharmacist in UK. You've seen how you can register as a pharmacist in Canada. You've seen where the pharmacists mainly work in both all of these countries, I would say. And basically, we touched base on what hospital pharmacists and what community pharmacists do as well. This was, I think, pretty much of the aim of our webinar. I think there will be, I'm sure there'll be some questions in your mind, and I'm happy to take them now, really. Over to you guys. Fire your questions, and I'm happy to take them. Ready. Bharti, I'm happy to take questions so far if someone got any.
So, sir, good afternoon. I'm having one question.
Yeah.
Am I audible? Okay, sir, where these
Yes.
exams will be conducted? In India,
Very
or
good.
we have to?
Right. Thank you, Bharti. I got your question, and a good question, guys. Unfortunately, you can't write any of these exams in India. The only exam, as I said when we were talking about it, is you can only do IELTS exam, English language exam, which is very basic and will be very handy if you do while you are in India. It's doable while you're in India. There is number of places. I did long time ago, but there was places in Chandigarh near us. There is place in Gurgaon where you can do it. In Delhi, there are numerous institutes that do IELTS exam. Please do that exam while you're in India. It will help you because when you are here, there is a lot more you have to balance. You have to, earn for yourself. You have to pay the fees. It'll be a lot easier if you can do the exam while you're in India. But the rest of the exams, the journey only starts when you are actually in Canada or UK. Have I answered it okay?
Okay, sir, fine.
Yeah, you happy with the
Maybe
answer?
I have learned that some exams are even conducted at Singapore or just nearby region to India. Is it true?
And I am not 100% sure. However, some exams, some countries have reciprocal arrangements. Reciprocal arrangements are where, like for example, UK and Canada here have a slight reciprocal arrangement where you can write Canadian exam, the evaluating exam, the first exam in UK, and then you go and write the other main exams in Canada. So it's not all the exam, but yes, maybe a few of these countries have. I'm not sure of Singapore, but very slight and very few countries. But I think, if you're planning to go to a country, and then why do you want to go a third country and write the exam there? You better be where you want to practice.
So like, so if I take some suggestions from you, like first I have to take PR and then, just be in Canada and then think about giving all these exams. Because,
Right.
I have to travel and again, just 2 or 3 attempts are there. So,
Very, very good. Yeah. So, right. Sorry. Can I have your name?
Dr. Kavita.
Hi, Dr. Kavita. Right. So you're right, actually. The unfortunately, the process of registering in Canada or UK only starts mainly while you're in there. And the practical problem we all get is you, for example, if you're a student, right? I'm going to touch base on both these different things that you asked. So if you're a student, the only way you can go there is have a student visa. And these courses and exam are not, they don't qualify to give you a visa, right? You can't book an evaluating exam and go there for a visa. You need a study visa, right? So you need to be doing a program. You need to go to do a master's or an MBA or any other exam, and then write while you're doing that. It makes things very difficult for us, but this is how we have done. Well, we are here to study. I came here to do a master's in pharmaceutics, and that's how I got involved into it. So I started preparing for it while I was doing the master's as well. It makes things very difficult for us, but this is how it can be done. The second option, which you just touched base on, was having a PR. Most of the pharmacists who got enough experience. So if you say, for example, you work in an industry, if you go over 2, 3, 4, whatever the limit, and they keep on changing, you've done that kind of experience and you've done a master's or a bachelor's in India, you can apply for a permanent citizenship in Canada, and you can go there, prepare from India. You can start preparing in India, write your IELTS here, maybe prepare for evaluating exam. As I said, is very basic exam. When you go over there, then you start the journey, right? It will be a longer journey. It will take you longer because obviously PR takes you a couple of years, maybe 3 years before it comes. On student visa, you can go very quickly, but it'll be a lot easier for people who have got families or who are happy to wait. It's better to apply for a PR from India, get your PR sorted. Life will be a lot easier. I won't say it will be easier, but easier than going as a student. And when you get there, that's when you start preparing for it. At least you don't have to study alongside doing the study for exam. Dr. Kavita, have I answered you well?
Yes, sir. Very well. Pretty well.
You
Thank you.
happy with it?
Yeah, sir. I'm having some few queries. If others may be
Yeah.
waiting,
Yeah,
I can mail you.
you can email me, no problems at all. I'll have left my email at the end of the slides. You can get in touch through them.
Okay, sir. Thank you.
Thank you. Anyone else? Bharti, have you got any more questions?
Dear participants, if you have any query, you can consult with Mr. Sandeep.
Yes, sir.
Yeah, this is the email ID of Mr. Sandeep. You can mail your queries to him also by email. So, Miss Bharti, I think we can conclude then.
Yes, sir. If students are not having any problem, any doubt, then we can.
Right,
So,
guys.
friends, have you any doubt regarding this?
No, ma'am.
No, ma'am.
No, ma'am.
No, ma'am.
Okay.
No, ma'am.
So,
Thank you, ma'am. Thank you, sir.
Thank
So
you, sir.
on behalf
Thank you so much, sir, for providing us some better
Thank you,
information.
sir.
Imran
thank you
ma'am.
very much.
Thank you,
Just
sir.
Thank you, sir.
Thank you, sir.
You're welcome.
dear
Thank you.
students and dear participants and our distinguished guest, Mr. Sandeep, on behalf of GEETA Group of Institutions and GEETA Institute of Pharmacy, Panipat, I am thankful to Mr. Sandeep for
You're welcome.
giving his valuable time, and all the participants and the pharmacy graduates. I hope they will get benefited by this talk and they will have much more opportunity in abroad also. So they can get connected with Mr. Sandeep by email also after the webinar if they are. I am for giving us his precious time. So I am thankful to the management for providing the platform where we can interact with such eminent personality. So thank you very much one and all present in this webinar. So Miss Bharati, can we have group photograph?
Yes, sir.
Or
Sure.
we can start the, okay. So all the participants, they can start their video. Miss Bharati, capture some of the moments.
Okay, sir.